Back on Pain Diaries, I'm going to welcome Dr. Lisa Kroopf at Monterey Pain and Spine Institute in Monterey, California.
Hello, Dr. Manzi. I'm so glad to be on with you today.
Thank you so much for joining us. I am so excited to have you here. I've known you for how many years now? Almost 10, I'm guessing.
Quite a while. Probably almost as long as I've been in medical practice.
And we've been on the conference circuit together and the WIPM, Women Innovators in Pain Management Society together. It's been an amazing journey.
Yeah, absolutely. On the board of directors and making some key decisions and helping our fellow women in pain management rise up and, achieve their goals. And so here we are today, one of your goals. I'm so happy to support you with this.
No, it's so exciting. I love being a mentor and an educator, and I know you and I have very similar practices. So why don't you tell us a little bit about your background and how you became interested, not just in pain medicine, but about wellness and educating your patients?
Yeah, absolutely. I love this topic, and I've actually taken quite a few notes from you and your practice. I am an interventional pain physician in Monterey, California, and my background training, my primary specialty is in physical medicine and rehabilitation, otherwise known as PM&R, right, like you. And then I have fellowship training in interventional pain management. And so we help people rehabilitate from injuries, chronic disease, and any other neurologic or musculoskeletal conditions, and we use interventional or procedural techniques to help alleviate pain, improve function, and get people on the path to healing.
Absolutely. Did you have a personal story that led you down that path?
I do, actually. So I grew up in a household where mom was a physical therapist. Dad was an attorney. They're both retired now. He specialized in personal injury. And so looking back, I definitely think that played a huge role. My brother and I played a lot of sports. My dad was more than a weekend warrior. He played sports 5 to 7 days a week. And I remember early on, him dealing with chronic knee pain related to degenerative joint disease or osteoarthritis. And at one point, his doctor told him, "You can't play basketball anymore. You have a chronically degenerated knee. You're moving toward a knee replacement. Think about it like having $100,000 in the bank, and every time you go play, you're taking out $10,000. Well, $100,000 was a lot of money back then. And so that made an impression on me to see someone that I loved not be able to participate in an activity that made them happy, kept them young and healthy and youthful. And so that was where I really wanted to make the difference with my patients and be able to intervene and provide them a path to healing, repair, and also improvement in their quality of life.
No, for sure. That's a really great reason why you're doing what you're doing. And I can totally understand, people have passions and they want to be out there and they want to be living life. And, for me too, that's kind of why I got into wellness and wanting to make people feel good and help regenerate and, get them on that path of nutrition and wellness and anti-aging, because it stinks being on the sidelines of life.
It really does. And that's what we see a lot of. We see some acute pain, like new pain and new injuries, but the majority of the people that I see in my practice have chronic degenerative joint disease or chronic degenerative disc disease. So bad backs, bad knees, hips, shoulders, and they are wearing down, right? And so they want to preserve their youthfulness. And they're looking for, they don't use the terminology always, but they're looking for anti-aging. Everyone wants to remain in this youthful state. They want to not only look good and have less wrinkles and have no gray hair, but they also want to feel good and have the energy that we had when we were in our 20s and 30s. And so that's where some of the treatments that we do come in. I have progressed my practice more toward a wellness mindset or prevention. And so instead of this sort of reactive, oh, I have pain, my pain level's 10 out of 10, I can't do anything, and I'm bedbound and I'm about to go to to the emergency department, but maybe I'll go see the pain doctor. We've tried to get away from that mentality and work toward prevention. So prevention of these flare-ups of pain and keeping our bodies healthy and keeping those discs nice and hydrated. And so some of the techniques that we use in our practice are targeted toward the source of those areas of pain. So for example, the intradiscal area of the lumbar spine is a major source of pain, right, within the discs. And so we have various different substances that we can inject into that area. But what we found is that regenerative techniques such as PRP and stem cell type therapies tend to provide the most healing and repair. Where in the past, we've done a lot of, you talked about cortisone injections in one of your prior episodes, and how the data shows that cortisone or steroid, which we train to inject over and over and over again, actually cause wearing down of the cartilage in the knee joint, for example. And so we are starting to move away from that. And it's been a really cool ride to be able to help people feel better, and really just get back to living a life not limited by pain.
No, absolutely. And I find there are a lot of misconceptions and having to educate people when it does come to pain management and wellness. And there has been a bigger movement for prevention instead of reactive medicine, where you treat it once that happens. And so, I think we're both employing supplements and nutritional guidelines into our practice, collagen therapies, to really help with treating patients, anti-aging type therapies, and really maximizing their biochemistry from the inside out so they feel good.
Absolutely. Yeah, I mean, the healing comes, like you said, from the inside out. Nutrition or food is fuel. If we are giving our bodies fast food and sugar and all the things that are really easily at our fingertips a lot of the times, our bodies are not going to be able to generate the energy that we need to basically maintain that youthfulness and health. And so we've looked at a way of being able to do a real quick scan on our patients and determine their level of nutrition and really kind of like their underlying health. So laboratory testing, blood tests, urine tests, skin biopsies, things like that have been utilized for many, many years. We now have a really non-invasive way to help patients see that what they're eating or their vitamins and supplements really are not adequate for what their body needs to live, to maintain, but especially in the state of being hospitalized or having an injury and trying to recover and heal and repair and do that physical therapy, they really need much higher levels of nutrition. And so actually I did want to share that with you. I have it right here. This is, I don't have it on, but this is called the biophotonic scanner, and it's made by a company called Pharmanex, which you can see right here. And it's really cool. I'll just show you really quickly. You put your hand, the palm of your hand right here, and this does a real quick reading, and it gives us a number between 10,000 and 60,000 in different color increments. And that tells us whether, if we're really low, that our antioxidant level is low. And the antioxidants are the big, major, many hundreds of different classes that come from plant-based food, fruits and vegetables. So again, that's an area where most Americans especially are very deficient. Only less than 10% of us get the minimum required daily amounts of fruits and vegetables. So the scanner has been a really cool way to give people a real quick snapshot. It takes about 60 seconds, and it helps set our patients up for success. So you and I can do, epidural injections and facet joint and RFA and all these treatments and inject some PRP over that torn tendon. But if our patient's body does not have the molecules it needs to heal and repair that tissue, they're not going to respond favorably to that treatment. Absolutely. And so this has been great as far as especially some of these treatments that we do that may cost people thousands of dollars. Mm-hmm. We really want to optimize their nutrition and their health to make sure we set them up for success.
Are there any particular supplements you find to be especially beneficial for people in pain and their overall wellness?
I do actually. A specific supplement that's called LifePak, and it's also made by that same company is how I got interested and found out about this scanner. It is loaded with antioxidants, all the multivitamins that come in a regular multivitamin, and minerals and everything that's needed for a daily requirement. And that's something that I vetted. There's thousands of products on the market, right? You can go into any GNC, Costco, there's hundreds of vitamins. And how do patients make choices about what to take? It's hard, and there are a lot of contaminants out there. It's difficult to find vitamins and supplements that are safe and efficacious for patients. So that's why I specifically recommend this one. LifePak is a nutraceutical. It's in the physician's desk reference. And I've personally been able to evaluate, based on the studies and articles that are available, this is a safe and effective vitamin to recommend to my patients.
Yeah, and you've been using this company, and there are other supplement companies out there, but I think the key thing that people don't understand are medical grade supplements are what they should be taking to get that absorption. Because again, the over-the-counter supplements, they're not necessarily free of pesticides. You don't know how much of what you're getting per se, even though the bottle says it, it's a range that is required. And the certificate of analysis is also a big deal. We really want to know that the ingredients in these supplements are safe and they're coming from a place that, you know, they weren't treated with pesticides or chemicals or other kind of additives.
Right. Like you said, the contaminants can actually be present in many vitamins and supplements, and people are unaware until there's a recall, right? Or a vitamin shop gets shut down, for example. And so those heavy metals especially are really not good for our system. We can't process and detoxify. And so it's so important to find a supplement that you trust and that is safe and, like you said, well absorbed as well, bioavailable. So there are certain ingredients that go into those. What I like about the Pharmanex product LifePak is that it has phytonutrients, which actually, when it presents to the body and it goes through the digestive tract, it looks like a vegetable, the way a vegetable or a fruit would look, the actual natural foods, when it's being digested. And that's what makes it even much more bioavailable than many of the other products that you mentioned over the counter. But that's just one part of the practice, although it is so important. Nutrition, anti-inflammatory treatments that are nutrition, procedural, as well as exercise and physical therapy. I call those really like the triad of anti-inflammation in our practice. And so it's so important for people to take in the good things that they need through their diet and supplements so that they can do those exercises, especially things like yoga, swimming, resistance training. Those all have been shown to have anti-inflammatory properties. And that's essentially what we are addressing here, is this chronic inflammation in all these degenerative joint and degenerative disc conditions that that people are suffering from.
Oh, I completely agree. And I love that we're on the same page on different coasts in the country. And it's just really cool to offer these kinds of, wellness treatments for our patients, because people don't want to feel bad. They look to us for guidance. How can they feel better? How can they get the most up-to-date information backed by science and literature? And so it's really key, that we really continue to educate people, support them along their journey, meet them where they are, and really just continue them on their path so they can live their best lives.
Yeah, absolutely. Do you see patients coming in that want pain medicines? Do you see that very often anymore?
It's lessened. I think people are also on this trend. With the data that's out there in the news and all these things, like, yes, some people still require some pain medicine at times, but there's a lot of bad publicity out there. And there's also good information to say, like, you don't necessarily need opioids to feel better. And that might actually make you feel worse. And people are acknowledging that now.
Right. And certainly pain physicians sometimes get a bad rap either for prescribing too much opioids or not enough opioids. And I would say every physician, even pain management, we have our own specialization. And so interventional pain, we tend to do less of the medication management, because we see the interventions being more successful. Pain management, like you said, has its or pain medicine has its place, but most of the people that I see have had really intolerable side effects from medications, or it hasn't worked. And most of them have tried many different pain medicines before they come in and see us. And so it is important for people to know that there are other options, that pain management doesn't always mean pain medicine, that there are treatments that we do that target the source of the pain and target the root cause. And again, just having a healthful lifestyle, including nutrition and exercise, is a big part of that, which is hard to do when you're in pain. And that's where a pain management physician comes in.
Dr. Kroopf, Monterey Pain and Spine Institute. Everybody contact her if you're in that area out in California. She's got a lot to offer. I'm so thankful you're on the show with us today.
Thank you, Dr. Manzi. Appreciate it.
You're welcome. We'll see you soon.
Best of luck.
This is Dr. Suzanne Manzi with Performance Pain and Sports Medicine, and this is Pain Diaries. We'll be back after a commercial break.